everyone, my name is Vasiliki Gkofa and today we're going to discuss about Avoidant Personality Disorder. In this video, I'm going to give you a brief overview of the diagnostic criteria of this disorder, the etiology behind the disorder, the attachment style that we are expecting to see, and of course treatment. I'm going to finish off the video by giving you some recommendations. So as always, I'm going to start off by giving you a brief summary of the symptoms that we might expect from someone who receives that diagnosis. So an individual that receives a diagnosis of avoidant personality disorder might actually be a very shy individual. They might fear others, and they might be more sensitive towards potential rejection from others. And therefore, what we might also see is that they might go towards extreme lengths in order to avoid any stimulation from the outside environment. What is also really interesting to mention here is that this personality disorder was added on our diagnostic manual, which is of course the DSM, in its 3rd edition. Right now we are in the 5th edition, so the DSM-5, and therefore I'm going to focus the diagnostic criteria based on that. So according to the DSM-5, we are going to have an individual who shows a pervasive pattern of social inhibition. There might be also feelings of inadequacy, and those feelings potentially have started early within adulthood, and we are also expecting 4 other symptoms out of 7 to be present. So those include any of the following that I'm going to mention now. So the individual might actually avoid any interpersonal relationship, any interpersonal contact because of high fear of being rejected, of being criticized, of being ridiculed even. And therefore, they will avoid any contact with another individual because of fear of potentially being embarrassed. They might also not try to form any intimate relationships because of fear of shame. And they will be preoccupied with that potential of being rejected by someone. And therefore, they will only actually interact with another individual and have an interpersonal relationship only if they know that they're going to be liked by others. So those are some of the diagnostic criteria that we tend to focus on. So let's move on now to the etiology behind this disorder. What Millen in 2011, and Millen is an American psychologist, actually proposed 3 contributing factors. One of them are biogenic factors. So by that I mean any hereditary or genetic factors that could explain the interpersonal aversiveness, the withdrawal from the environment. What we might also see is what we call infant reaction pattern. By that I mean that, for instance, if an infant is actually more cranky or more hyper irritable, the parent might actually reject the child. And what that will lead to is the child feeling more anxious and of course withdrawing. The second contributing factor is experiential factor. So by that I mean, again, maybe parental rejection, for instance, criticizing or ridiculing the child could affect their self-confidence and of course their autonomy. That might also be present in groups. So within their peers, we might have peer group alienation. So by that I mean, of course, that peers might criticize the other child, might ridicule them, and therefore the child might want to socially distance themselves. And the last contributing factor is of course the self-perpetuating. By that, I mean that certain experiences that we had within early life, let's say during childhood, we had certain negative experiences when interacting with other individuals. Maybe we were rejected, maybe we were ridiculed. And therefore, what we will do is actively distancing ourselves from any social contact in order to avoid having those negative experiences once again. But what happens is that by actively avoiding those experiences, we're also avoiding any experiences that might prove otherwise. So any experiences that might prove to us that actually it can be a positive interaction and we can have a positive interpersonal relationship. So what will happen is that unfortunately it will be this continuous cycle. The individual might also be highly suspicious, so hypersensitive, and what I mean by that is that if from another person there's any form of disregard towards their face, they might think that it's because of me and because I am inadequate. So those are some of the contributing factors that Millen has proposed. So let's move on now to the 4 subtypes of avoidant personality disorder, again proposed by Millen. So we have phobic, and that is overall anxiety towards certain objects, certain circumstances that are adverse. We might have conflicted, and by that I mean some fear towards dependency, but also independency. And of course, that shows some confusion there present. We might have hypersensitive, and by that I mean what I said before, the individual might display high suspiciousness towards others, towards interpersonal relationships, and we might have also the self-deserting. And with that, we might have some features of melancholia, some fragmented self-awareness, and of course we might see that the child or the individual later on might try to discard any painful memories. So those were the 4 subtypes. Now, when it comes to the attachment style, it's most likely that we are going to have the fearful attachment style, since there is this fear of being rejected, of being criticized by other individuals. However, it has also been proposed due to research that we might also have the anxious attachment style, and this is because research showed that when you do display certain faces that are supposed to be neutral, the individual might actually appraise them as more negative than they are actually. So let's move on now to treatment. I'm going to touch upon the counseling side of things and of course medication. So in terms of counseling, what we might notice is that the therapist might also display some countertransference. So the therapist might also think that the client is being resistant or that they're not trying enough, and therefore they might think that the therapeutic journey is actually hopeless. However, according to research, the counseling experience, the therapeutic journey with someone with avoidant personality disorder can be quite promising. According to Aaron Beck, and if you don't remember who Aaron Beck is, he is the father of cognitive behavioral therapy, so do check him out. And he proposed that what needs to be addressed is the collaborative process. And of course, what also needs to be questioned are the 2 obstacles that might arise. One of them is mistrust towards others' expression of caring. And the second is, of course, the fear of being rejected. Let's not forget that someone with avoidant personality disorder will have the fear of being rejected, of being criticized. This is one of the things that we mentioned before. Therefore, the therapist might also be someone who might reject them along the way. So this needs definitely to be questioned. So other things that we might find present within therapy is to actually replace maladaptive beliefs. So we might do that by trying to find the core, the root of the maladaptive belief, and trying to replace it with more adaptive, with more fruitful beliefs. We might also have some role playing within the therapeutic journey, and through role play we might actually see that the client is experiencing certain behavioral displays that they had not noticed, and therefore that might actually change that belief that they had, that maladaptive belief. So this is one of the ways that we can, through trial and error, change those maladaptive beliefs, and hopefully through the collaborative process that you're going to build with a therapist, what will happen is that they might actually generalize that relationship with other interpersonal relationships that they have within their lives. When it comes to medication, we might actually see that SSRIs are quite helpful, and they are helpful in how they're going to deal with that sensitivity of being rejected. And any medication that actually impacts dopamine might also be quite beneficial in terms of novelty-seeking behavior. So this is something that we can also prescribe if we are psychiatrists. That's it, guys. Thank you very much for watching our video on avoidant personality disorder. If you have any other interests in terms of personality disorders or any other psychological topics that you would like us to talk about, you can definitely write a comment below and we can try to attend to that. So, as always, I'm going to give you a recommendation to watch a movie if you are interested in this personality disorder. One of those movies is called Adaptation, and the main character, played by Nicolas Cage, is actually presenting with some features that we discussed in this video. So I'm not gonna say anything more, but you can definitely check this movie out if you are interested in this personality disorder. That's it. Thank you very much. Bye.